too to John and Daryl for those very inspiring introductions. Sorry, Patty said I shouldn't look at her, but it's a natural thing to do, so I'll ignore you there. Thanks to WHAV and to Women's Health Victoria for organising this fantastic event. And I think I'd like to take the opportunity to acknowledge the leadership of Women's Health Services themselves in this space, not only in getting and keeping prevention of violence against women on the agenda, but in particular in their role in harnessing the leadership of others. So we just saw a great example of leadership from John here at NAB in business. We know that there are lots of councils in the room who are also showing great leadership on prevention in their own communities, and community services as well. And women's health organisations are quite unique in pulling those all together in a sort of coordinated effort to prevent violence, and I really want to acknowledge that role. And I'm also very glad to be here today to present on behalf of our new organisation, the National Foundation to Prevent Violence Against Women and Their Children. It's possible you've never heard of us, at least for a lot of you, and that's normal because we are quite new. So we were just established last year. We were created jointly by funding from the Commonwealth and Victorian governments, although we've now had the Northern Territory and South Australian governments join as members. And all states and territories have been invited to join, and we've got our eye on them, so we're really hoping to get them in. But importantly, we're a not-for-profit. We're a non-government organisation, and we operate at arm's length with an independent board. But we cross party lines and jurisdictions, and the idea is that we can place addressing and preventing violence against women and their children at the top of the national agenda. We were created out of the national plan, and we continue to have links to it, and I'll just talk a little bit more about that in a moment. So just in terms of giving you a sense of what's been happening over this very first 12 months, we're just over a year old now, so we're established in July last year. We started, before I joined, at the end of last year, there were these extensive national community consultations, which a lot of you might have been involved in, to sort of set the agenda of the foundation, to identify what our priorities should be, where we should be focusing our work and so forth. And we got amazing participation in that, and I'll talk a little bit about the outcomes at the end of this presentation. Our chair is Natasha Stock-Despoja, and she's been showing a great deal of national leadership in advocacy, writing op-ed pieces in the newspapers and presenting at the National Press Club, for example. As I mentioned, we've had the NT and South Australian governments join. We've also signed a major partnership agreement with Vic Health, and I'll talk more about that in a moment, but as you know, Vic Health have really led the way in building the evidence base on prevention of violence against women here in Australia and arguably internationally, and we take that very seriously, and we're very keen to sort of not lose that work or be in any way in competition with it, but rather be in partnership with it and look at how we can support it. Another big highlight for us over this last 12 months is that we got an additional $3 million funding from the Victorian government, which means we're sustainably funded for 5 years, which is not a bad thing for a not-for-profit. We're happy with that. And we're about to launch our 5-year strategic plan. So in some ways, the timing of this is unfortunate, because if we'd been 2 weeks later, we could have talked in much more detail about what's in the strategic plan, but today I can sort of give general directions at least. So I was asked to talk about the national plan and the national context. I should flag though, as I've said, we're at arm's length from government, so I have absolutely no mandate from government to talk about the national plan, but I'll just give you an overview of it for those that aren't familiar with it. So just by way of background, it's a 12-year agreement. It was actually launched in 2010 and goes through to 2022. It's very important as it's the first ever cross-jurisdictional and now bipartisan shared commitment to the issue. So it's not a federal government plan, it's not a Commonwealth government plan, it's a COAG plan. So it's actually an agreed policy of 9 governments. And anyone here who's ever worked in any arm of government will see that that's something of a small miracle. So I think we should be very happy that it exists, and extremely happy that under the new federal government there's been a commitment to keep it going. So we really do have a bipartisan commitment to this 12-year agenda. It has 6 action areas under the overarching policy, and 2 of them are focused uniquely on primary prevention. It's called Communities Are Safe. The first and the second, relationships are respectful. And there's also a third area of focus on Indigenous communities and strengthening Indigenous communities, which of course has many prevention implications as well. The National Plan is implemented through 4 3-year action plans. I have to do my maths then for a moment. So the first action plan has now come to an end in 2013. Some of the highlights of that was the creation of a national hotline, our first ever national hotline for victims of violence, the 1800 RESPECT hotline. Also on the prevention end, a social marketing campaign aimed at young people called The Line. And there were some pretty significant grant schemes targeted at prevention in respectful relationships, education and community action grants. Which again I'll talk about a little bit later on. And importantly for us, the first action plan actually established a foundation, and it also established our sister organisation, which is now called the Australian National Research Organisation for Women's Safety. Some of you may remember it as the NCE, the National Centre of Excellence. It's gone through a few iterations. So the second action plan, just very quickly, it was released in June this year, so under the current federal government. Has 5 national priorities, and you'll see that the first 2, driving whole community action to prevent violence, is uniquely prevention focused. The second, understanding diverse experiences of violence, I think is extremely important to prevention as well, as is of course number 5, continuing to build the evidence base. 3 and 4 are more about how we respond better to existing violence. So this second action plan, a lot of you may be familiar with it. It includes a lot of state and territory level commitments, and most of the national level commitments in the field of prevention in some way involve the foundation. So I suppose in answer to sort of the question for my presentation here today is what is the foundation's role in the national plan? We are separate from government and arm's length, but we're linked in because we're involved in a lot of these actions under the national plan at the national level. So we have some things that are shared with national plans and things that are sort of different, I suppose. Most importantly, we have a shared vision. So the national plan and the foundation both have this long-term vision of an Australian community that's free from violence against women and their children. But our approach is different. We are independent, as I keep emphasising, and our focus is uniquely on primary prevention. So while the national plan is looking at the whole gamut of how we address violence against women and their children, from prevention, early intervention through to response, as is uniquely on primary prevention. So I'm going to go quite quickly over the next 4 to 5 slides because I think Penny talked a little bit about prevention. I think most people in the room are involved in primary prevention, so I don't want to sort of give you a lecture on things you already know. But just so we're clear on what we're talking about, what is primary prevention? We're talking about going upstream, stopping violence before it starts, which means addressing the underlying causes of violence or contributing factors to violence in the attitudes, behaviours and practices that support, justify or minimise it. So some of these initiatives will be aimed at the whole population. You can think of broad-based social marketing campaigns or actions in schools to build respectful relationships, for example. And some are tailored for specific groups, whether demographics or groups that have particular needs because of all contexts. So working with partners is absolutely essential because there's no way any organisation can do this alone. Everybody here knows from your own experience that prevention it's basically about hearts and minds. It's basically about getting people to think differently, work differently, look at the whole social context differently. So it's not something that can be driven from any central point. It's something that needs to engage everybody. So working with partners, especially government, other NGOs, especially the women's health sector, councils, community services, businesses and the response sector is all really important to our work. That's just a quote from Natasha Stock-Despoja of what we're talking about when we think of prevention. We're talking about a country where no one lives with threat or fear of abuse or violence, whether in their homes or other places, and that's what the foundation's about. So these are the slides I'll particularly flip through quite quickly on the underlying causes of violence because I think a lot of people in the room might have seen them a million times. You will know that Vic Health in 2007 reviewed the international evidence, all of their studies on what sort of factors were correlated with higher levels of violence against women in different circumstances and countries. And they produced the first global sort of meta-analysis of that research in order to unpick and identify then what can we say are the underlying causes of violence, that is contributors or determinants of violence. And they were the first to do that internationally, but it was later reinforced by studies from the World Health Organization and by the UN at the Commission for the Status of Women in 2013. They found that there's no single cause of violence against women and their children. There's multiple causes, but the key underlying factors, which they call determinants, relate to, I suppose, two things. One is power differentials, and that is namely unequal economic, social and political power between men and women, whether at the relationship level or whether at the societal level, and the laws, practices and so forth that fail to support or address this. And so I suppose going to your presentation, your introduction this morning, John, you were talking a lot about the family violence clause work that NAB has been doing, but your pay equity work is just as much about preventing violence against women as the direct work that names violence and deals with violence. And in fact, a very important part of preventing it because it's about redressing unequal power. The other really main area that is an underlying factor or determinant to violence is attitudes and social norms. So while the first thing, power differentials, is arguably about the structural issues, whether it's economic power, social power, political power, attitudes and social norms is more about what's in people's heads and how they think about, in particular, gender. So rigid gender roles and stereotypes are very key to determining levels of violence against women, or seeing violence as a means of asserting male dominance or solving disputes. So the international evidence is now really clear on this, and it's also coming, the picture is now emerging that these other factors which have been listed as risk factors because they can be correlated with higher levels of violence, like alcohol abuse, like childhood experience of violence, even socioeconomic disadvantage or inequity. They contribute, but they only contribute when they come into play with the two key things above. So obviously not everybody who drinks is violent, and not all people who are violent drink. But when you have somebody who holds these gender inequitable attitudes and stereotypes who also drinks, that's when the violence can be exacerbated or made more severe. And arguably we can sort of draw similar lines of argument with childhood experience of violence and so forth. It really is about the norms and the unequal power, however. That's the key thing that we have to go to. And the line I'm starting to use is that although it's very hard to go to these issues of gender, it's the stuff it's where we get the most backlash, it's where we often get the most resistance. It's what we need to do to actually go to the underlying causes of the problem. We're not going to sustainably stop or even reduce, even make a dent in prevalence figures on violence against women unless we do that. So what I've been saying is trying to address violence against women without addressing gender is the equivalent of trying to address lung cancer without addressing smoking. It's absolutely crucial, and we really need to go there, as uncomfortable as it makes people and as difficult as it makes our lives. So you'll all be familiar with this sort of socio-ecological model now from Vic Health. This is basically just saying we can't address the problem of violence by just working with individuals, or by just working with organisations or systems, or by just working on laws and policies. We have to do all of these things and work at all of these levels. Okay, so back to just the Foundation's role in this context. And Patty just shout at me if it's time to finish.
I won't shout, but I'll try.
So I suppose, where have we come from? Where are we now with prevention, and where are we going next? This is a little world according to Lara, I suppose, prevention journey so far, so feel free to argue with me. There's a lot more complexity to this than the slide would indicate. But basically, very briefly, I suppose the 2007 Vic Health Framework really established in Victoria this idea that we can go upstream. We don't just have to respond to violence after it's happened, so-called downstream. We can go upstream and start stopping it before it starts. And what the framework did was give advocates, policymakers and practitioners a really solid evidence base and model, for, like blueprint for how you would go about doing this. So it really had a galvanising effect in Victoria, and it inspired those working on the front line and in places like local government, media, sporting clubs, faith-based organisations, schools, all over the place, that violence against women is preventable and we could do something about it. Its impact is profound, I think, and when you notice it when you travel to other states and territories and see there really hasn't been that same level of shared understanding established for how we do prevention, let alone that, I suppose, the engagement of so many different players in this work. Okay. I just wanted to, sorry, before I go on to the slide, one thing I did want to say at the end of this is, I suppose, while we, in Victoria, as I said, we have established this, we have very well evaluated activity now as well, and a lot of you will have been working on that in these different settings. So we now know what works in different settings in the Australian context for a lot of activity. But nationally, as going to the next step slide, it hasn't been taken to scale. So while we know there are very good practice schools programs in existence that will work to change attitudes, will even work to reduce future levels of violence among participants, there's no way they're in every school in the country. Like, that's the next challenge. So the next steps for the prevention journey. We know primary prevention is key to ending violence against women and their children, but our action needs to be based on a national approach. It's not something that can stop it or should stop at the Victorian border. So our challenge is to develop a national approach that will provide this sort of game-changing opportunity and let us develop shared understandings, knowledge, etc. to stop violence against women in Australia. But it is a relatively new area in most states and territories. The evidence is still evolving in terms of how we do take things to scale. We are addressing a very complex, arguably wicked problem. Some people will be familiar with that. I don't think it's as simple as, say, addressing even something like drink driving, which, as we know, took 30 years, or smoking. We know we can do it, we know we can use the same sort of methodologies, but I don't think it'll be as straightforward in some ways because it's a much more historically and socially entrenched issue. We're challenging really deeply held attitudes as well, going back to what I talked about with gender in particular, and that's where we're likely to make this resistance. And this is before we even get to the sort of different jurisdictional issues of like different starting points, different infrastructures, different contexts. So the foundation really needs to rise to these challenges. And we are quite, we have no template for this because we're quite unique. As far as I know, there is no other national organisation working solely on primary prevention of violence against women and their children at an arm's length from government, but with connections into policy anywhere in the world. So we are sort of not only working out how to do prevention, we have to work out how to operate as an organisation at the same time. And I suppose just core to how we do this is that we take an evidence-based and evidence-building approach. We're hanging on to that. We need to sort of steer clear of politics, and that we do it in partnership with others. We know that we can't do this ourselves. So what does all this mean for the Foundation's work? We know we need to address underlying causes, challenging gender stereotyping and violence supportive attitudes. So we don't want to be the sort of organisation that just talks about how bad violence is. We want to go to the deep issues and really challenge those. We also want to promote gender equality through laws, policies, institutional and organisational systems and practices, and work at that systemic level as well. And we need to find a way to lift up good practice beyond single initiatives or initiatives that aren't sustainable for any reason. And I suppose what I mean by that is even initiatives that might be sustainable in one setting or one location, what we want to do is take the learnings from that and see how we can make it, expand it and make it more sustainable more broadly and ideally nationally. And we need to do this across multiple levels and settings. So we need a coordinated approach among stakeholders and with governments. Sorry, I'm very excited about this and I tend to go on. All right, so very briefly, basically, I told you we did those consultations at the end of last year. Our stakeholders told us what the priorities should be, and it's similar to what I've just outlined, that we should gather existing evidence, we should work on an evidence-based and evidence-building principle with emerging best practice. We should consult and develop, and Women's Health we can thank for this idea of nationally consistent terminology and definitions to build a shared understanding. There were many calls for a national primary prevention framework, especially from those that were familiar with the big health one and knew what it had done in Victoria. And there were calls to sort of look at what the key legislative and other systemic factors were that we could work with to sort of embed primary prevention activity at a national level. And there was also a call for the foundation, and this is right from our initial funding and constitution, that we do broad-based attitudinal change, that we do run campaigns, social marketing activity and so forth, because we have that national reach and we're sort of funded to do so, and we can I suppose leverage off our role as a national organisation to do that. But we do commit to doing that in an evidence-based way and a partnership-based way. So just very quickly, as I said, I can't sort of talk about the whole scope of our activity, and I really hope to soon, but some of the key initial work that we're doing. We have committed to developing a national prevention framework, and many of you will know this, and it's in partnership with Vic Health and AMROS, the research organisation. And this process is already, we're just underway. Vic Health has started it by undertaking a literature review. We're about to go into a consultation process at the end of the year and probably going over into February. We really, I suppose what we're thinking with this is not only, it's exciting because I know another document isn't necessarily the most exciting thing in the world, but when you see what the Vic Health document has done here and the leverage it's created, it does make me very excited for what it means nationally in terms of establishing a shared understanding and approach to prevention. And more importantly, I think in some ways the process will be the show. We are actually going to take a while to develop this so that we can engage as many people as possible in that process. And we're going to do consultations in different jurisdictions, with different groups. We want to we want to build new evidence and analysis on prevention, especially on intersectionality and looking at how we can achieve equality of outcomes for different groups, whether this is Aboriginal and Torres Strait Islander communities, culturally and linguistically diverse communities, or women with disabilities. I'm really looking forward to hearing Adele and Karen's presentations and to the panel to talk more about that. So yes, we think it'll provide a roadmap for action by communities and non-government. We really want to engage people in that effort. All right, she's approaching. I'm going to flick through this. We have a few other things happening, by the way. I'll be able to talk more about them later. This is my last slide. Shall I do that?
Yes.
Yeah. All right. So basically, we're working now with our member governments to look at developing pilot projects in different settings with different groups.